afternoon, and welcome to the NCPDP State of the Association Address. How many of you attended the opening panel discussion this morning? Let me see a show of hands. I don't know about you, but I found the discussion to be positively provocative and a challenge to strategic planning and action for all of us. There is no question that the practice of pharmacy is evolving, and the pace will continue to accelerate. As the Standards Development Organization for Pharmacy, NCPDP is evolving as well, and we must do so expeditiously to support the future of pharmacy. NCPDP is advancing initiatives to ensure that pharmacists have the data and interoperability necessary to provide clinical services as an integral part of the patient care team. At the same time, we are refining in-workflow electronic transactions that streamline the business of pharmacy as well as support technology innovations. The goal is to relieve pharmacists of administrative burdens so that they can operate at the top of their license and receive payment for their clinical services. This graphic shows our alignment with industry initiatives and current trends in improving healthcare. This opportunity exists for pharmacists to have an exponentially greater impact on health outcomes. Pharmacists can increase patient access to coordinated care, optimal medication therapies that incorporate precision medicine, better chronic care management, use of digital health tools, and solutions for social determinants that improve health. This is transformational change, and it requires communication and collaboration among industry associations, policymakers, regulatory agencies, public health agencies, other healthcare providers, and standards development organizations. As you may be aware, NCPDP conducts multiple advocacy tours each year. Last year, we had 34 visits with lawmakers, with their staff, and regulatory agencies to reinforce education on NCPDP as a trusted resource. We highlighted our strategic initiatives and standards that support national priorities. Many of our initiatives are aligned with the recommendation of ONC's High-Tech Pharmacy Interoperability and Emerging Therapeutics Task Force. Here to highlight NCPDP's alignment with the task force is NCPDP board member Pooja Barbara.
Thank you, Leanne. So the High-Tech Task Force was a great opportunity for the pharmacy industry to have a voice in front of not only ONC, but the broader healthcare and health IT community. We had SMEs from the pharmacy industry alongside with providers, technology vendors, and patient advocates who met every week to discuss the overall charge from ONC, which was to identify recommendations to support interoperability between pharmacy stakeholders for medication management, patient safety, and consumer engagement. So I do want to give a shout out to Tricia Lee Roll from ONC, who I know will be in the audience listening. You know, she really led the charge around this and was able to rally us and to show ONC leadership how important pharmacists are to the care team and how we need to start a dialogue around pharmacy interoperability. You know, we were lucky to have 5 very strong industry leaders and NCPDP members on the task force. Myself, Christian Tadris, Afton Wagner, Scott Robertson, and of course I can't forget Shelley Spiro, who is one of the task force leaders and really helped us in pulling our recommendations together. We also had presentations from several other NCPDP members and the executive leadership team. So as far as the recommendations, we ended up with 32, and I say that number and I often get eye rolls from people saying there's no way we can tackle 32 recommendations. But to me, it really goes to show the importance of this dialogue and how important it is to get stakeholders involved. So here at NCPDP, we've been working closely with ONC on prioritizing these recommendations. We found several areas where we may already have standards or work in place to meet some of the recommendations, from adopting existing standards like RX Fill and RX Change, as well as a focus on data exchange for public health, which we have with our facilitator model. One of the other recommendations was patient matching, and we have our UPI, and also standards and transactions related to care coordination, which really falls into our work that we're doing at Work Group 20. So you can see we have a lot of alignment already with many of the recommendations, and we're continuing our work with ONC to prioritize and align our strategic initiatives.
Thanks, Pooja. The task force also called for collaboration between NCPDP and HL7 standards development communities. The ask: work together to prioritize use cases and accelerate interoperability amongst pharmacists, other providers, and public health agencies. This is already ongoing. The leadership of NCPDP and HL7 met multiple times a year to identify where coordination makes sense. We proactively engage NCPDP subject matter experts to participate in HL7 accelerators and document use cases for NCPDP standards that can complement HL7 FHIR standards. Many of you in the room are already involved in this effort, and thank you for that. This year, we are focused on collaboration with the HL7, DaVinci, Vulcan, Karen, Gravity, and Code-X accelerators. We are pleased to have Chuck Jaffe, CEO of HL7, here with video comments on the importance of the NCPDP and HL7 collaboration.
Hi, I'm Chuck Jaffe, the CEO of HL7. I'm sorry that I can't be with you, but it's an honor just the same to have been invited to speak today. For nearly 4 decades, HL7 has been a leading voice of healthcare interoperability worldwide. In fact, we've provided the technical infrastructure for exchanging half of the world's healthcare data. None of that could have been possible without the dedicated collaboration with our standards partners. For many years, collaboration between NCPDP and HL7 has led to invaluable advances to the communities we serve. Now, more than ever, that collaboration has grown to the benefit of our care providers and to our patients. Today, there are multiple ongoing initiatives that advance the way in which pharmacy data is exchanged, analyzed, and curated. In the years to come, I believe that this collaboration will provide an even greater impact on all of us. Congratulations again to NCPDP for answering the call, and thank you.
During our association tour this past year, we confirmed that we have strong strategic alignment with pharmacy associations, and we also discussed opportunities to collaborate. Here with us has an interview for our association tour and some of the outcomes is Steve Molinex, NCPDP's Executive Vice President of Public Policy, Professional and Industry Relations.
Thank you, Leanne, and hello, everyone. NCPDP's National Association Tour is an initiative that we started more than a decade ago. We did it for really 3 reasons: to further increase our visibility and understanding in the industry, and to create additional opportunities for collaboration. Our most recent tour began in the fall of last year and included 8 face-to-face meetings in the Washington, D.C. area. That was followed by 6 virtual sessions that occurred this past February, with several additional requests for later this year. In every case, NCPDP shared its plans relating to the 3 strategic pillars of access to care, patient safety, and the role and value of the pharmacist. We also discussed our efforts in public policy, interoperability, clinical communications, and the importance and relevance of our NCPDP Foundation. The results of these interactions were very noteworthy. For example, we were very pleased by the degree of alignment with the associations regarding the evolving role of the pharmacist and the recognized need for interoperability to support this transformation. Other measurable results included increased legislative and regulatory engagement, increased work group, task group, and annual conference participation, sign-on support by the CEOs of APHA, ASHP, and the NACDS regarding proposed federal grant funding for improved interoperability in healthcare. And generally increased information sharing among these national associations and requests for NCPDP to function as a convener and also as a resource. Lastly, as we expanded our engagement to new organizations, as we did this year with the Associations for Accessible Medicine and the Network for Excellence in Health Innovation, or NEHI, NCPDP continues to expand its footprint. So all in all, this most recent association tour may have been the best ever, and we at NCPDP were very excited about the opportunities ahead. Back to you, Leanne.
Thanks, Steve. We also share multiple national priorities that impact public health. One of those is patient matching. Not only is it needed to improve patient safety, it is essential for care coordination amongst all providers, including pharmacists, to improve public health. A recent pilot funded by NCPDP Foundation accomplished patient matching by using our universal patient identifier powered by Experian Health, UIM, and NCPDP standards. The pilot, which focused on increasing interoperability, provided proof that the NCPDP UPI improves the ability to identify a patient across multiple data sets in multiple states. This is what's needed to manage patient matching and identification across the healthcare ecosystem. Patient matching will continue to be a top priority for NCPDP as we continue to educate policymakers and the industry on the value and performance of the NCPDP UPI. We have also placed a high priority on collaborating with health plans. We want to explore how pharmacy data and the NCPDP standards can be leveraged to support goals for better patient outcomes, improve patient safety, and efficiencies that translate to lower cost. Mariah Vandy Dole, who leads our health plan subcommittee, has a progress update on this initiative and a personal connection to this effort.
Thank you, Leanne, and good afternoon. I have a rare disease, and for years I spent time going to medical office visits of all kinds. One day, a care manager from my health plan called me, and she asked me about my story. She asked me what was going on. At the end of our conversation, she said, Mariah, based on what I'm seeing in your file and hearing from you, you need to advocate for yourself. That care manager used data and quite literally saved my life. Now, you might be sitting there today asking yourselves, what the heck does this have to do with an NCPDP health plan subcommittee? Well, it's a good question. I'm here to tell you it has everything to do with it. The standards and exchange of information that we design here at NCPDP can improve and save lives just like mine. The real question is, what are those needs? What do health plans need from NCPDP to render these types of outcomes with other members? Fueled by curiosity, the Health Plan Subcommittee has met with external health plan experts to better understand these opportunities and also share more about NCPDP's fine work. We've hosted conversations with the Chief Medical Officer, author of a book titled Health Plans Unmasked, and we've met with clinical leaders in health plan care management, pharmacy, prior authorization, network contracting, and more. And you know what? In each of these instances, each individual has been wowed by the work of NCPDP. Proudly, some of these external contributors have even joined our committee. Now with our expanded team meeting monthly, we discuss our exfil, e-care plans, real-time benefit exchange, and how the utility of this information and new standards might provide benefit. It's a great start and there's work ahead. I'd like to leave you today with two thoughts. One, if you know an innovator at a health plan, let's share an NCPDP introduction. And two, please stay inspired. Please know that your work, your energy is valuable. It's making a difference. Thank you for helping people like me feel the hugs of my boys one more time. Have a great day.
Thank you, Mariah. It is so important to be reminded of how our efforts impact human lives. We are making progress on multiple initiatives that will equip pharmacists to participate in collaborative care and value-based arrangements. As pharmacists offer more clinical services and participate in these collaborations, they may need to provide credentialing information similar to what other providers are required to do. Documentation of education and training may be requested to verify eligibility for providing clinical services and for reimbursement. As part of our VBA initiative this past year, NCPDP published an executive summary on pharmacist credentialing. In it, we discussed the need for more standardization and technology integration to make it easier and cost-effective for pharmacists and health plans to accomplish credentialing. A top priority this year is updating and expanding the eCare plan to support pharmacist participation in value-based care. The eCare plan is a joint standard of NCPDP and HL7. It is commonly used today by many community pharmacists to share patient care information with other providers and payers. We believe it has greater potential for use and adoption. Crystal Chisholm will share an overview of how we are looking to advance the eCare plan to support better coordination of care. Crystal is an active member of our VBA subcommittee.
Thanks, Leanne. The Value-Based Arrangements, or VBA subcommittee, led by Katie Russell, has been doing extensive research on the pharmacist eCare plan and how it can be used to support pharmacist participation in value-based arrangements. Previous work by the subcommittee showed that the pharmacist eCare plan had 67% of the data elements utilized for VBA to support clinical data exchange. The eCare plan allows for bidirectional exchange of patient data between pharmacists and other healthcare providers for coordination of care, and more importantly, a documentation platform that captures information needed for reimbursement. Last fall, High-Tax Pharmacy Interoperability and Emerging Therapeutics Task Force submitted recommendations to ONC to support interoperability between pharmacy constituents and the exchange of information necessary for medication management, patient safety, and consumer engagement, with the eCare plan mentioned throughout the recommendations. Thus, the need for the use of the standard is clear. Strategic discussions with key stakeholders are currently underway to identify specific updates that must be made to align the pharmacist eCare plan with newer versions of FHIR, as well as suggestions regarding any new functionality that may be needed to add to enhance the user experience. So what's next? To promote adoption of the standard, we plan to communicate its importance to our members, offer education on its usage and implementation, and launch campaigns for wider acceptance across healthcare providers and payers. With a streamlined effort from our members and increased support of the pharmacist eCare plan, the full potential of our pharmacists could soon be realized within the value-based care model.
Thanks, Crystal. NCPDP is also actively working on initiatives that support pharmacists' role in pharmacogenomics, also known as PGX, and digital therapeutics. Last year, we invited 30 subject matter experts to discuss opportunities and challenges for pharmacist-led PGX testing. We published an executive summary on what we learned. The initiative is moving forward in the PGX task group. We also continue to collaborate with the Digital Therapeutics Alliance. In addition, our Digital Therapeutics Task Group is reviewing a foundation-funded project that developed pharmacy and medical benefit workflows to show how digital therapeutics can be incorporated into benefit designs. As we endeavor to support the future of pharmacy, innovation is critical. It is the theme of this year's conference and the impetus for our newest Workgroup 20, Coordination of Care and Innovation. It was important for the NCPDP board to approve this as a new work group, in addition to and not part of Workgroup 10, which addresses professional pharmacy services. Christian Tadras, our incoming board chair, will share some thoughts on what differentiates Workgroup 20.
Thank you, Leanne. For those of you that have attended Workgroup 20, you've noticed that while it adheres to our ANSI accredited processes, the experience feels a little different. You've probably noticed things being done in Workgroup 20 that are familiar to you and that you've seen them at NCPDP, but they seem out of place. That's intentional. Why? Because coordination of care and innovation, by definition, require adaptation, flexibility, and thinking differently. And it's this mindset that perfectly encapsulates what's attracting participants and why our board approved this new workgroup. Workgroup 20 is centered on innovation and acknowledging the rapid changes in healthcare delivery where pharmacy service standards have an opportunity to inform and drive interoperability. And its scope and goals align perfectly with emerging healthcare topics such as value-based care and the use of AI. Workgroup 20 also seeks to attract a diverse set of stakeholders and technology experts to execute proof of concepts related to coordination of care using standard and non-standardized innovative approaches. Workgroup 10, on the other hand, is centered on the development of best practices and standards to optimize patient outcomes and safety in direct patient care settings. Both workgroups collaborate closely and depend on one another to empower and support pharmacists to do the work they've been trained to do. Perhaps the easiest way to think about the differences between the two workgroups is this. Workgroup 20 is focused on innovative models of care and technology, while Workgroup 10 ensures consistent delivery and documentation based on pharmacists' professional standards of care and patient engagements. I encourage you to get involved with both Workgroup 20 and Workgroup 10 to help us drive innovation, enhance patient care, and ensure pharmacists are able to practice at the top of their licenses across all practice settings as a valued member of the patient's healthcare team.
Thank you, Christian. In August of 2023, we created 2 new task groups under Workgroup 20. The Health Equity Task Group plans to propose an action plan to close the gaps in the capture and standardized exchange of health equity data. The Admission, Discharge, Transfer, or ADT Task Group will make recommendations for sharing ADT notifications with pharmacists to improve medication management during transitions of care. The newest task group under Workgroup 20 is the Pharmacy Technology, or PTI, Task Group. PTI was previously a board special committee focused on identifying disruptive technologies and the potential need for standards. Jeff Deitch, one of the leaders of the inaugural PTI Board Special Committee, and now the task group, agreed to share his thoughts on the role of this group.
Thank you, Leanne. I'm Jeff Deitch, CEO of InfoWorks Data Services and the co-chair of the PTI Task Group under Workgroup 20. As Leanne expressed, this is a task group where we're trying to drive innovation and bring together stakeholders from across the pharmacy industry to discuss the new technologies that are emerging and the effect they're going to have on the practice of pharmacy. This group's designed to bring in business people, technologists, and everyone and anyone who's knowledgeable about or working on and with new technologies to discuss the impact that they're going to have. Also out of this task group, we want to see what changes we need to make to NCPDP standards and maybe develop some new standards for the exchange of new types of data, new types of information that aren't even being addressed currently. Ultimately, we all know that the practice of pharmacy is going to be very different 5, 10, and 20 years from now, and we want to set the stage and make sure that we're prepared for and dealing with what it's going to look like. Please consider joining the PTI Pharmacy Technology Innovation Task Group. You can join easily through your profile page on the collaborative, or I'm sure you'll see me walking around all week here at the annual meeting. Feel free to come up and strike up a conversation. I'm always happy to talk about PTI and everything else related to the pharmacy technology industry in general. Thanks for your time. Look forward to meeting you.
Thank you, Jeff. Also in pursuit of innovation, the leadership of NCPDP and our elite partners participated in an ideation lab this last month. We explored how AI is used now in healthcare and the potential application and implications for NCPDP, the future of pharmacy, and standards. As we push forward this year to advance new standards to support pharmacists and care coordination, we are also preparing guidance for implementing updated standards. Final rules are expected from CMS for all the standards you see listed on this slide. Our State of the Association report would not be complete without hearing from the NCPDP Foundation. But first, I want to recognize a very special person, Charlie Polito. As some of you may know, Charlie is a co-founder of NCPDP and also a founding board member of the NCPDP Foundation. We recently honored him with the Legacy Foundation Award, the NCPDP Foundation Charles Polito Excellence Award. The award will be presented each year to the Foundation Grant Project that optimizes the vision and the purpose of the NCPDP Foundation. This year, it was awarded to STC Health for its efforts in support of the National Facilitator Model. Strategic Advisor at STC Health, Tom Groom, accepted the award, and he is here with us today. We are also honored to have Mike Popovich, President and CEO of STC Health, here today. Mike and Tom, would you please stand and be recognized? And now, Pam Schweitzer, incoming chair of the foundation, is here to share an update on the foundation, which is now in its 12th year.
Love hugs. Thank you. Hi, everyone. Thank you, Leanne. Okay, how's everybody doing? Okay, it's with great humility and enthusiasm that I step into the role of chair of the NCPDP Foundation. I'm honored to serve, and I appreciate you entrusting me with this responsibility. I'd like to thank Michelle Vancura for her leadership and vision this past year, because she's paved the way that has allowed for this smooth transition. The projects funded by the foundation are innovative and groundbreaking, yet they kind of fly under the radar. This type of work, building infrastructure, is kind of right up my alley. As you know, similarly, work of a public health service officer is frequently invisible to the general public. And it's much the same with healthcare IT. The standards, especially with so many projects aimed at advancing, scaling, and spreading these standards, they're kind of invisible. Yet, I know, and you know, that the reward is not in the recognition or in the immediate validation. It's for delivering better outcomes for the greater good of all. Working together, the critical work we do is instrumental in shaping the future of healthcare. In 2023, the Foundation Board of Trustees completed significant behind-the-scenes work to define who we are beyond the arm of NCPDP. So it's exciting to share with you a snapshot of these efforts. And today, at the end of my presentation, I will be revealing a new NCPDP logo, contingent on us being able to raise our collective goal of donations of $1,977. So get your phone and scan the QR code up on the screen. And there's a print out there if you need a QR code too. And let's get those donations going. In honor of the Foundation's 12th anniversary, not only will we be able to reward it with a logo reveal, one lucky person is going to get a complimentary ticket to Denim and Diamonds tonight. If everyone just gives $12, we're going to reach our goal. So if you're feeling inspired by the work of the Foundation and you want to multiply your impact, click on the button and make your donation occur monthly or quarterly. That was drumming up. I'm looking right now. I'm seeing everybody grabbing their phones, right? Okay, you can see that the Foundation's updated purpose is to support programs, projects, and people that drive quality health care through the use of standards-based information technology. This means the projects the Foundation supports are truly an extension of the critical work that NCPDP does, including the work that you do in the work groups and the tax groups and the committees. The foundation pushes the boundaries to bring NCPDP standards full circle, and we're funding the research that identifies gaps that reveal where healthcare systems need to be in the future while technologies and standards are currently being used to their full extent. In our history, we've funded 21 grants, which have brought us to over $1.2 million in grant funding, which is amazing. In 2024, our goal is to fund another $500,000, and we're well on our way there. In 2023, 3 new grants were approved, and I'd like to highlight one of the newest, RX Live. Now, if you're looking to be anybody here that's part of work group 20 or 11, give me a wave. Awesome. Oh, look we're over here. Very good, all over, good. This project lines up right with the great efforts being made in each of these work groups. So RX Live is utilizing NCPDP standards and their expansive network to pilot a process for bidirectional communication of patient-specific clinical information. This will allow pharmacists to consult with patients, share their clinical recommendations with physicians, and track adoption of pharmacist recommendations. As we know in this room, this will be a huge step forward to better coordinate care and improve patient outcomes. I shared just one project example, but as you can see, there's many, many more. If you've already scanned that QR code on your table and you flip over, you can see the graphic up close that you see up on the screen. The foundation-funded projects start with you and the work you do in task groups and work groups. Your standards set the stage for use within the healthcare ecosystem, including organizations and universities that utilize these standards in new and innovative ways. Or they may even prove that we need a new standard. A successful result has the potential to put groundbreaking healthcare IT work back in front of you to develop and put into practice. This is an amazing opportunity for you and your own organizations to be part of. Before we wrap up, I just want to take a few minutes and share with you how the foundation channels your donations. Our support flows through strategic initiatives. We call them pillars, and each pillar is supported by a key funding partner. You can see we have 3 pillars along with their supporting partners here. Our pillars are expanding the role and value of the pharmacist, enhancing patient safety, and increasing patient access to care. Also noted are the grant projects funded within each pillar. We are excited to announce we've added a 4th pillar, empowering coordination of care and innovation. We are so grateful to Cover My Meds, to have them on board as the founder's donor for this pillar with a donation of $100,000. The newest pillar highlights the need for industry collaboration to support pharmacists' ever-increasing potential to achieve true patient-centered care. This pillar focuses on projects that shape the future of healthcare standards to include more transparency for pharmacists and patients. So here's the moment you've been waiting for. Drum roll. Okay, that was pretty nifty. Okay, we have, I'm looking here, oh my gosh, we have far surpassed our $1,977 goal with, let me see, $31,396. Holy cow, that's awesome. And that's all been within these last few minutes, so that's pretty amazing. So anyway, thank you. So with NCPDP's matching funds, that's about $62,793. Wait, shouldn't it be a even number? Okay. So anyway, to support programs and future initiatives. The new foundation logo was designed to better represent goals of the foundation apart from the parent organization. We've modernized the foundation's look and feel with updated colors and a Southwest flair. I love it. I hope you agree it's a representation of the foundation's history and the many opportunities ahead for us. So to kind of final close up here, the lucky donor from today who won the Denim and Diamonds ticket is going to be contacted via email, so be sure to check those messages. And really, sincerely, thank you to all for donating today, and thank you for all that have donated in the past and are committed to donating in the future. There's a ribbon, make sure you put a ribbon, for those that donated, put a ribbon on your badge. There's a foundation donor ribbon. And just, if you haven't had a chance to do it, no donation is too small. We appreciate everything. We appreciate all the work that you do. Thank you. Okay.
As always. Oh, awesome. Thank you, Pam. Before I wrap up, I want to encourage you to take a look at our recent annual report and how much more we have accomplished this year, thanks to many of you. Keep it up, stay involved. Even more importantly, stretch your view of pharmacy and what NCPDP can do to support the evolving role of the pharmacist. Innovation starts here. It's what gave birth to NCPDP. It's in our DNA. We may operate behind the scenes, but what we do, how we innovate, and how we collaborate impacts our healthcare now and in the future.